My name is Andrina Muhammad, and we are privileged to be here today with Dr. Karen Wingfield. Dr. Karen, welcome to Touch 106.1 FM.
Thank you so much. It's really a privilege to be back.
We're very excited because we have the opportunity to talk to you all year about issues that face our community surrounding health. And you have devoted your life to just really promoting health. So you've been to Touch 106.1 FM before, and what I would like to do is just reintroduce you to our listeners, to just give them a little bit of background about who you are. Dr. Karen, as she is called, Dr. Karen Wingfield, MD, PhD, is a practicing radiation oncologist right here in Boston, Massachusetts. And a radiation oncologist, for those of you, I'm just learning myself, is a doctor who uses X-rays to treat cancer. So Dr. Karen has devoted herself to issues around health, and we're going to get a chance to talk to her today. But can we start by just asking you, how did you even get into this field?
Mm-hmm. So we talked a little bit about this a couple of months ago, but I think I'll be brief this time. It really wasn't something that I was hoping to do my whole life. There are some folks who, from the day that they're 5 years old, know that they want to go into medicine. That was not the case for me. But what I did want to do is help people. And so initially I was into music. I'm a singer. I trained in opera. I'm a classical singer. And so that was on my heart. But I actually found myself struggling with that. I felt that it wasn't able to do what I was meant to do. There was something that was missing. So when I was in my undergraduate education, I decided to major in biochemistry and really loved the sciences. I loved basic science. And I loved the thought of, wow, maybe I can actually cure something, whether it be cancer or some other disease. So I decided to go to medical school really as a way to learn about human disease processes. I had been doing my research, which was basic science, and I'd been doing that on insects and really wanted to move into the realm of looking at human diseases. So it was almost by mistake that I went to medical school. But I found that I was touched. I was touched by people. I was touched by people who are vulnerable. Anyone who's been sick knows how vulnerable you are when you are at the mercy of people that you may not know. You may not know them at all, right? You go to the hospital, you have nurses and physicians who are working on you, quote unquote, who do not know you. And it's a very vulnerable state. And I found that people just needed some comfort. And I found that I was good at it. And that was my gift. And so it was something that I really felt pulled to do. And it was a great way, I think, for me to kind of realize what was missing in my life, which was my desire to really reach out and help people.
When did you realize that? Because it sounds like you sort of had an awakening, like a moment when you were helping people and you were immersing yourself in these studies, that you realize this is what I'm supposed to do.
Yeah. It was during my second year of medical school. So the first year of medical school is lots of book learning, right? You're sitting in a classroom. But it wasn't until I had an opportunity to actually put hands on patients that I realized that was what I was meant to do.
That's incredible. And you also spoke a little bit about it before, but you did so sort of on your own ammunition. You didn't have necessarily support, encouragement, but you just took yourself and went forward.
Yeah.
How did you push yourself? Because medical school, I heard, is somewhat tough.
Yeah, it's a bit of a challenge. It's interesting. I think part of that, with people who know me from high school knew I was always very competitive when it came to grades and doing well. So that, I think, part of that drive has always been innate. But what drove me more when I went to medical school, folks who were listening a couple of months ago may recall, I went to medical school as a single parent. I realized very early on that if I wanted to do something and I wanted to tell my daughter that she can be anything she wanted to be, that she could do anything she set her mind to, that I needed to set that example. So that drove me in a way that I think I would have never been driven before, because it was very challenging to negotiate and to juggle having a 5-year-old child when you start medical school as a single parent and still be able to compete. And it really was hard. So I had to, my grades weren't going to be at the top, because here I was with everyone else who was at the top of their class. So it was a challenge, I think, emotionally, but it was very important for me, I think, as a person. I think having my daughter early helped mature me in a way that if I had just been on my own, I don't know if I would have come to the decision. I don't know if I would have actually gone to medical school if it wasn't for me having her, which is interesting.
And that's beautiful, because basically Ashley, who is Dr. Karen's daughter, she's with us today, and we're really glad to have her. But you're saying that Ashley served as a gift.
Indeed.
To help you go towards your call.
Absolutely.
That's incredible. And it actually focused your life.
Absolutely.
That's incredible.
Absolutely. And I say that all the time. And, I'm not glorifying being a single parent. It was tough. But I always say things happen for a reason.
Yes.
Things happen for a reason, and God has a plan above and beyond what we may see right in front of us. And I hold on to that every single day, regardless of what's going on around me, regardless of the ups and downs. I was just sharing with Brother Mark that my husband has been very sick. He was actually in the hospital and came home yesterday. And, you just push forward. You do what you have to do. I was in clinic on Friday. My patients didn't know. They don't need to know. But at the same time, what I find is that the fact that my husband is ill gives me even more passion.
Yes.
Be more organized with my patients, to understand, to sympathize with them and what they're going through. And I think it makes me a much better doctor.
It has to, because I'm sure that there are many people who have had experiences going into hospitals and not feeling as if anyone understands where they're coming from, that their pain is small.
Yes.
And then also the theme that I'm hearing come from you is just taking the hard things in life and actually using it as something that leads you towards your purpose. You're saying, your husband is ill. He just came home from the hospital. He's suffering, and you're taking that and you're using it to heal.
Yes. Absolutely. And I think one of the things that hopefully will come out of our discussions is really being able to encourage people that despite your circumstance, you look for the good.